Hello, and welcome to AFSPA Live, our monthly digital broadcast designed to give AFSPA members and eligible federal employees a place to ask questions and get answers about past AFSPA Talks topics, their benefits, and wellness needs. You can ask your question through the chat box on whichever social media platform you're streaming AFSPA Live, YouTube, Facebook, or LinkedIn. If you're not able to join us live, call our toll-free line prior to the broadcast at 888-435-0757 and leave our team a voice message that we may play back and answer live on air. Just tell us who you are and the question you'd like us to answer. I'll see you at the next AFSPA Live.
Hi, everyone. Welcome to AFSPA Live, a live Q&A broadcast session that we stream every last Thursday at 10 a.m. Eastern Time, or 11 a.m. Eastern Time. I do know what day and time it is, I promise. My name is Maddie Norton, and I'm excited to be moderating the show today. I'm a communication coordinator at AFSPA, and today we are discussing preventive care coaching. And as always, we have AFSPA CEO with us, Kyle Longton, and special guest today is John McQuillan from Teladoc. How is everybody?
Doing very well, thank you, Maddie. It's 4 o'clock in the UK, so I
Right.
just checked that, but we're a bit ahead of you in the game, and we're kind of getting towards our sunset here, but really good to be here.
Good day so far?
Yeah, lovely day so far. Thank you.
Of course. We'll kind of start off easy with, what is preventative care coaching?
Now that is a great question. And we are super excited because this is a new product that's been made available to AFSPA from the turn of the year. This is something we've been working hard on at Teladoc to make sure that we've got something that really hones in on the preventative element of care for your members. What it is, in a nutshell, if you like, is a tailored program. The aim of this program is to provide insight and enable AFSPA members to put an actionable plan that's designed to support their behavioural change in order to keep them well, and I suppose really be their best self from a health perspective. What it means is that you get assigned a personal healthcare coach, and they establish a relationship with you and support, educate, and inform you of the actions that are required to improve your overall health. And that includes assessing kind of lifestyle risks and coaching on healthy habits and guiding on in-person care requirements. So there's much more to that, but just in a kind of nutshell, hopefully that gives you a flavor for what we mean by preventive care coaching.
Right. And Kyle, I know that this was something you were kind of wanting to implement for AFSPA members, FSBP members, and I'd love to know a little bit more about how this program came about.
Sure. And I will just start with a disclaimer that I am actually in our DC office today, and my connection may not be as good as it should be. So I apologize for any glitchy video. But in early 2024, we launched for members in the United States the P360 program. And this is virtual primary care through Teladoc Health in the United States. And we started looking for something similar for members outside the United States. We were working with the Bureau of Medical Services, the Department of State. They have medical providers in what they term medically austere regions who are basically caring for themselves as well as the rest of the mission staff. And they were looking for some sort of support. And even though I promised Teladoc that if they could make that program available to our members overseas, we wouldn't tell anybody else. They understandably were concerned about licensing and other issues. But John, who has been come through for us in so many ways, starting back in 2020 when we sort of launched the V Health program in the midst of really the height of the COVID pandemic, worked with his team, and they came up with this great idea of the preventive care coaching program. So that we do have some support from knowledgeable professionals who can support our members, particularly those who may be managing chronic conditions or right on the edge of developing a chronic condition anywhere in the world. So this is available for members outside the United States, which of course is a significant number of our members. and it's within the same V-Health program that many of them know from the general medicine program. And we're delighted. We've only had it now for almost 2 months, but I hope I think we've already got some early feedback, and we might be able to hear a little bit of that later today. I don't want to get ahead of ourselves.
Right. That's all great to hear, because I know when I moved to DC and kind of had to find my primary care physician, I got blood work done, and I was kind of like, I read the results. I was like, okay, this is great. But I felt like I was kind of needing another step of like, well, what do I do after this? And I feel like this program is perfect for things like that. But just in case, why might someone need preventative care coaching?
Yeah, that's a perfect question. So it's very broad spectrum. So there's many ways in which people will engage the program. So we see a huge variety of reasons. So it might range from understanding the risk of certain conditions, such as heart issues or diabetes, for example, or for that individual to be more informed, to look after themselves generally from a healthcare perspective, to be more informed about healthcare situations sort of specific to them. Maybe they have high BMI, or general fatigue, or they're anxious, or they're experiencing perimenopause or menopause.
Mm-hmm.
Quite often something that affects most of us are sleep issues. So they really want to be targeting key areas for improvement, whether that be their diet, exercise, mobility, or nutrition. So really what the program does is it enables members to get back in control of their overall health and well-being. And this is really defined through the initial intake of the program, where we ask a number of questions of that individual to get the full picture. And that ranges from allergies to pathological history, any medical history that they've had, lifestyle and well-being assessments, any family history or current treatments that they have, or any sort of toxic substance consumption. And then we are enabled to start to formulate a plan that we'll be able to put in place with that individual to hone in and impact on those key areas for them.
Perfect. So would this be a program, would you say, for, people with high blood pressure, even, developing like pre-diabetes or things like that? This is the program for that?
Absolutely. So if there's healthcare concerns that you have that you don't really have the insight or are struggling to understand how to manage those or how to improve on those, then certainly this is the program for you. And what this enables you to do is engage with our preventive care coach, who is backed by a team of professionals. So we have nurses, we have physiotherapists, nutritionists, and mental health support professionals as well. So each individual will be different, and through that intake model, we will then be able to assign the most appropriate resource to work with you really over a period of time in order to drive behavioral change, to reduce the blood pressure, to reduce the cholesterol, to help you eat healthier, to help you see a change in your lifestyle that's hopefully going to be very impactful on you and potentially your family as well.
And John, I think you hit on this, is that you're working with, yes, you're maybe interfacing with sort of one person, but they're supported by a whole team. And I think that's one of the things that sets this program apart from some of the other coaching programs that we offer to members, and where maybe they say, I want to reduce stress, or I want to eat better, or something like that. This is sounds like a more holistic approach. And I'm just wondering, how frequently would a member be interacting with this program? Is this sort of a weekly or even a monthly check-in, or is it maybe a little less frequent than that?
Yeah, so great question, Carl. What we're experiencing is, number one, this is very tailored. So it all depends on what that individual needs as to how we might go about putting in a plan, which then feeds into the kind of how much interaction occurs between our coach and the individual. What we're experiencing is that there's some patients and some members that will be interacting on a weekly basis for a number of interactions, and then others whereby the plan is, a bit more, the cadence is a bit more spread out. So it might be every 2 to 3 weeks and over a kind of longer period of time. And really that comes down to our coach assessing that. How do we get the best habitual changes and influences for that individual? And no two people are the same. So I think really this is about that, ongoing interaction, but really depending on what they've told us shapes the level of interaction that we're going to have over that period of time.
Right. I think that's great, especially when I went into, get my blood work done, I was kind of given like a little sheet of facts to be like, this is how you can lower your blood pressure or, whatever. And I was like, okay, great. But long term, what are we doing here? So I think that this is a great program, especially for, like you said, making lifestyle changes that are permanent and are great for you and your family. And so I'll kind of say, speaking of families, can anyone who has an FSBP membership, can their dependents use it? Is there an age restriction? Would love to know more about that.
Yeah, so this is targeted at the over 18s within the population, but there may be occasions where there's questions that the adults have in relation to their kids. So we will always field those and try to support you with those. It might not mean it's the full program, let's say, that the over 18 would have, but we're always open to having discussions with our populations to find out what their needs are and the needs of their families. So we are orientated to support it, but the full kind of sessional based support and ongoing support will be with the over 18s.
Got it. And the next kind of question I'll ask is, what if someone going through the program encounters challenges or setbacks? How does that coach support them through that?
So very normal, right? This is kind of what we expect. And I think this is really where the real value kicks in, because you've got the relationship, really this is an encouragement to really be transparent and to have a relationship with the coach, because they're the ones that can help you. So the initial plan is put in place, but those check-ins are fundamental to understand, how you are progressing. Are you able to adhere to the plan that you've collectively agreed, or have you hit some bumps in the road along the way? And all too often there may be bumps in the early days. So I think really what our coaches, how they approach it, and this is kind of an expression that I coined, but I quite like it, see what you think, but they'll recalibrate, reinforce and realign. So they'll really look at that individual, and it's no judgment. The idea is that these people are designed to support you and your population, and understand that things may not be a straight line to success. So applying that philosophy, we really take you're not alone in this approach. So you can feel really that you can turn to them, or maybe really when you'll turn to them rather than if, when you have setbacks, and then you can recalibrate, reinforce and realign really the plan.
I love those 3 R's. Really good.
Well, and I'll just say that having participated in a number of different programs, not exactly like this, but in some ongoing, I'll just encourage members to be honest. It is okay. We are human. We're going to have setbacks. There is going to be a day where you go off plan. You eat something that you weren't planning to, or something along, or you don't get up early to exercise or something. But be honest about that, because otherwise your coach can't really help you. If you're saying, I'm exercising every day, I'm only eating X number of calories, or keeping, for me right now it's managing salt and things like that. Like, it's not incredibly helpful when I'm like, yeah, I'm doing all that, and it's not the case. So I just want to encourage members out there. We all struggle with this, and this is the reason we have programs, and it's tailored, as John said, as you said, John, it's tailored to support, and there's no judgment. That's the other thing, that the coach is not going to shame you. They're not going to scold you. They're going to help you.
Right. And I think that's great too, because at the end of the day, you're there to better your health. And I think it's an admirable move to make on your own. So especially like you want to get the best out of the program, and you can't do that if you're not honest with yourself and your coach. And speaking of, honesty and, success stories maybe about the program, John, can you share any success stories with us, or any good feedback that we've received?
Yeah, absolutely. So some early insight into the program. So we've had a number of cases. At the moment, they tend to be centered in the kind of European region, but not exclusively. So we've seen cases in Germany and Italy, France, the UK. So we've seen a kind of widespread adoption of the program. And some of the key subjects we've seen so far tackled or covered are perimenopause, kind of symptom management. We've also been able to support with counselling endeavours, weight management, coaching, as well as career and life stress management. So they're some of the current kind of early themes that we're seeing in terms of what may be more popular, within the AFSPA population. But clearly, as mentioned, there's such a wide variety of opportunity really to engage that we will see those extend out. But albeit early days, we've received some very positive feedback. So I've got a couple of quotes here where one individual has told us that their overall knowledge regarding their health has improved, and they'd rate the meeting at 10 out of 10. And they really appreciate the time to help me better myself. So it's fantastic to hear that. Somebody else who has been engaging with our nutritionist has said that they understand their goals with the nutritionist very well. They've recently started with those recommendations, and they're ambitious about what they can achieve. And then somebody else wanted to actually rate us more than 10 out of 10 if it was possible. So it's early days, but I would say that the feedback is extremely positive, and I think it's a bit reflective of what we see within our wider services, is that when you give the opportunity for your population to engage easily and conveniently through the technology and reach a trusted healthcare professional, then they've got that platform to be able to engage on the things that have been on their mind. These things have probably been with them for some time, and they've not really been enabled to have the platform to discuss them. So we're really encouraged by that feedback, and we'll continue to let you know as that comes in throughout the program as well.
That's all great news to hear. I would love to know a little bit more about how the app kind of works. I'd love to know, especially since people are in other countries, especially across the world, how, like, when are people available, or when can they schedule an appointment? How long does it take to see someone? I kind of love to know some things about that.
Yeah. So number one, it's a global service, so you can access that from wherever you are, whenever you need it. We're going to pop up, I think, some QR codes as a reminder for the members to be able to. There you go, right on cue, buddy. And what that means is they may have the app already. If you have the app downloaded, you simply go into the app, and you then, on the drop-down menu for the services select, you select Preventive Care Coach. You complete some very basic information about your situation, and then you send that through to us. Then you will receive a questionnaire where we want to get a bit more information from you, and that's some of your kind of lifestyle risks or what you're aiming to get out of the program. Then that's put in front of our healthcare coach, and we agree a time with you for that first session. So really straightforward. We know where you are in the world when you engage the program, so that we can connect with you at a convenient time within your time zone. And then really the program is underway from that point on.
That's great to hear. And we can see that people are already scanning the QR code. So that's great news. And we did get a great question from YouTube. Tony has asked, if you start with a coach and don't feel that you connect with them, can you change to a different coach?
The answer is yes. We hope that that's not required.
Right.
And we do everything we can to ensure that that's not the case. We put in a lot of training and ensure that our healthcare professionals really treat everyone as an individual, and that's very important to us and very important to them as well. But also we do understand there might be some times where that maybe doesn't click. So absolutely feel empowered to be able to request an alternative coach, and they can then start the journey with you. Yeah, absolutely.
Okay.
Perfect. And I'm going to keep the code on the screen probably for the rest of the show, just so people can have access to it. But we did get a question submitted from a member, and I thought it fit great with the show. So they asked, I'm 59. Lately, when I go to the doctor and describe a new issue, he tells me it's just part of aging. I feel disregarded and dismissed, especially when I'm in pain. My doctor has been great for years. How should I address this? They asked, but I also thought they might be a great fit for the Preventive Care Coaching program.
Yeah, exactly. So I'd encourage this member to engage in the program. I think all too often we hear things like this where it's hard getting the airtime, it's hard feeling listened to. You may not feel that you've been taken seriously, which is really disheartening, because your healthcare is the most important thing. So it's not uncommon that we hear this through kind of treating physicians, but certainly for this member, I would encourage them to engage the program, tell us what their background is, tell us what their healthcare challenges are, and we will give them a platform to have that discussion to try to support them. And we have the Gen Med program. So if they are symptomatic and it's more of a primary care nature, again, we'd encourage them, obviously the same app, just select the Gen Med option on that, and you can engage with a primary care physician. So there's a couple of options available for this individual, and we want to try to support you, particularly if you're just struggling to get a platform to engage about your challenges with face-to-face physicians.
Absolutely.
And I'll just add, Wendy, if you're overseas, this is a great option, because I think regardless of where you are, our time with an actual physician face-to-face is often very limited. I drove an hour each way for an appointment last week and saw my doctor for 10 minutes so he could read lab work to me,
Right.
and then refer to my problems as, in your case, he said, well, most middle-aged people have this. He looked at my information. But I will also say that, Wendy, if you are in the United States, any of you, and you're looking for something, I will encourage you to also try the Teladoc P360, the virtual primary care program that we have that's available within the United States. Those initial appointments are usually available within 10 days of signing up for the program. And they're also, that initial appointment usually lasts almost an hour, between 50 minutes and an hour. And you're really engaging in conversations. There's similarly a whole care team there to support you, order labs, et cetera. So that is an option if and when you're in the United States.
That is great to hear and great to know. I will ask a question that we received about progress. I know you've mentioned meeting with your coach, and it's really tailored to who or what you're seeking and trying to get help for. But specifically, how is progress tracked throughout the program, and how will I know if I'm on the right path?
Yeah, I think this comes down to that relationship with the coach. So the idea is that you are provided with a plan, and that can be supplemented with additional information such as nutrition plans and links to relevant information that's going to be supportive of your journey, literature. So there's a number of things that we would support you with, and really we would then arrange the first check-in point with you. And at that point, we then will work through what progress has been made, if there's been those challenges, those bumps in the road that we talked about, and how we might go about, kind of adapting that. We might encourage you to keep a food diary, in which case we would sort of check in on the results of that. If you've then been encouraged to have any physical examinations or any bloods or anything in a kind of physical setting, then our healthcare coach will get eyes on those results as well when you come back into the program. So I think over the course of time, we really formulate that clear picture about you and about what's working for you and how we might continue to tweak the program so that you get the best results.
That is great to know and great to hear. And I really do hope our members take advantage of this, especially if you're overseas, a foreign service officer, and you might be feeling stressed lately, or you recently got results back. It's the new year. Definitely look into this. Highly recommend it. And Kyle, I know you wanted to mention some things as we head closer to 11:30. So if you'd like to go ahead.
Sure. Yeah. And I do want to say, Maddie, thank you very much for pulling things together today. John, thank you so much for joining us. And I do want to say to our members, those who are watching, those who may watch a recording of this later, we are paying very close attention here at AFSPA to everything, all the changes that are occurring within the federal space and the impact on federal workers, especially AFSPA members. We are trying to keep up with it. We are trying to pivot as quickly as possible, and we will keep information coming to you in various forms. So please follow us on social media. Please look for emails from us, but please know that we are here for you. We have a number of programs, including the Preventive Care Coaching program, but also the General Medicine telehealth program, both in the U.S. and overseas. So please make use of those programs. Please take care of yourself right now. A lot of you may be facing disruption, return to the United States unexpectedly, and so forth, and a great uncertainty for everybody. Please take care of yourself. Please let us assist you in that in all the ways that we can. Don't hesitate to reach out to us, to ask what the options are, and just know that we are here for you. And we will be back here a month from now with some more information, and we'll be reaching out to you and providing more information in the meantime via Facebook, LinkedIn, Instagram, pieces on YouTube, and in your email inbox. So please keep a watch for all of that, as well as our blogs and newsfeed on AFSPA.org. So thank you all very much for joining us today. John, thank you again for your insights and for putting this program together. This is a unique program that you all constructed for AFSPA members, and I want to make sure our members understand that. So I'm delighted to see multiple people using the QR code during the program, and hope more and more people use this and make use of the program. So thank you very much.
Absolutely. And if you are watching later in the day and maybe are on your phone watching and you can't scan the QR code, definitely check out our wellness page on AFSPA.org. That's where you'll find all of the teledoc and telehealth information, especially about the Preventive Care Coaching program. So definitely take a look there. Otherwise, you can reach out to us on social media. Be on the lookout for March events. We have some financial wellness webinars, as well as I believe a retirement webinar for specifically women. So be on the lookout for that. And as always, we will be back next month. And also be on the lookout if you want to register for annual meeting, which is March 7th. It is March 7th, right?
It is, but I didn't know. I thought we were at capacity.
So you can still register. We are technically at capacity. You can still register though, especially if you want to get the recording after the fact, once we've trimmed it down and everything. So register for that if you want. If you have any questions, reach out to us on any of our social medias or at outreach@afspa.org. Otherwise, thank you again, John. This has been great. I think this program came exactly at the right time for everyone. So we appreciate you joining. And otherwise, we will see everyone at the next AFSPA Live.
Thanks for having me. Really appreciate it.
Thank you.
Thanks for watching our broadcast. Join us again the last Thursday of every month at 11 a.m. Eastern. Also, don't forget to look for AFSPA Cares on all of our social media channels: YouTube, Instagram, Facebook, and LinkedIn.